Hello everyone. In this video, I am going to discuss about systemic inflammatory response syndrome, so called as SIRS. What is this systemic inflammatory response syndrome? Remember, it is one of the most common cause of intensive care morbidity and mortality. Okay, and it is always a topic of concern for critical care medicine physicians. Now let us see what is the criteria to say that a patient is having SIRS. Number one is the temperature should be either more than 38 or less than 36. Tachycardia more than 90 beats per minute. Respiratory rate more than 20 and PaCO2 less than 4.3 kilopascal. WBC count should be either more than 12,000 or less than 4,000 or more than 10% of immature forms, that is so-called as the banned forms of neutrophils. And presence of two or more of the above features qualifies for SIRS. Remember, this criteria is very, very important. Once this is done, now let us see what is the etiology. Once we thought that it was only the infection that is responsible for causing SIRS because we have something called as PAMPs, that is pathogen associated molecular patterns, that is responsible for triggering this event. But later we found that it's not just the pathogen, any damages. So it is earlier it was PAMP, now it is called DAMP, that is damage associated molecular pattern. They are an activator of innate immunity. Okay, yes. Coming to the pathophysiology, there are three stages of SIRS. Number one stage, cytokines are released that will promote wound repairment and recruitment of the phagocytes directed at the pathogen. Number two, the cytokines will be released in small amounts in the circulation, which will increase the local response, which will stimulate the growth factors. What is that? Platelet-derived growth factors that causes recruitment of macrophages. And there also will be, and the stage 3 is what happens. Suppose, despite all these levels, homeostasis is not restored. At that time, there is a massive system reaction which occurs as a result of cytokine storm. And as a result of the cytokine storm, MODS happen. What is MODS? Multi-organ dysfunction syndrome happens, or MODS happens. Okay, yes. Now let us see the typical pathophysiology of SIRS. Any factors like infection, trauma, or surgery will activate the immune system, which will cause recruitments of leukocyte, platelets, and polymorphonuclear leukocytes. These will release to TNF, that is TNF alpha, that is tumor necrosis factor alpha, and interleukin 1. Okay, that may cause fever, release of stress hormones that is responsible for increased sympathetic stimulation, and cleavage of nuclear factor kappa B inhibitors, which causes production of interleukin 6, 8, and interferon gamma. It is interferon gamma that is responsible for classical macrophage activation pathway. Hope you studied in pathology. And interleukin 6 is the main culprit, okay, and that is responsible for the pro-inflammatory state. And suppose if there is any homeostasis, okay, is achieved, then no issues. What will happen? Compensatory anti-inflammatory response syndrome occurs. That is because of interleukin 4 and 10. Suppose if there is a homeostatic imbalance in favor of the pro-inflammatory state, cytokine storm happens. That is responsible for SIRS, and finally multi-organ dysfunction syndrome happens. Okay, yes. So there is always a balance between the pro-inflammatory and anti-inflammatory mechanisms. Suppose if the the side is more towards the anti-inflammatory mechanism, no issues. But suppose if it is not against the anti-inflammatory mechanism, if it is towards the pro-inflammatory mechanism, cytokine storm and MODS happen. So coming into what are the triggering events, okay, of the or what are the factors that triggers this pro-inflammatory state? Number one, direct injury to the cells. Number one, indirect injury through activation of serum factors, complements, kinins, kallikreins, coagulation, and fibrinolysis cascades. And number 3 is endothelial injury. Actually, this is the hallmark. What is the hallmark pathophysiological feature of SIRS? It is always endothelial injury and dysfunction, which will worsen the inflammation through arachidonic acid metabolites like prostaglandins, and that causes humoral and cell-mediated immune mechanisms. Okay, fine. So coming into how will you make the diagnosis of SIRS? As I told you, what is the diagnostic criteria for SIRS and what are the investigations we will do? First, biochemical or hematologic, that is complete blood count, where we have to see leukocytosis, whether it is less than 4,000 or more than 12,000, or whether there is more than 10% immature plants. Then ABG will be done, so that elevated lactate levels we can assess, that will suggest what? Metabolic acidosis and decreased pH. And blood urea nitrogen and creatinine ratio for kidney function. Then what? PTA, PTT for liver function, serum albumin, calcium, magnesium for electrolytes, C-reactive protein. Again, it is a marker of sepsis. But what is the best marker of sepsis? It is always procalcitonin. It is not CRP. it is procalcitonin. Okay, we have a new marker that is called as SUPAR. Okay, SUPAR is another newly developed marker for newly found marker for sepsis assessment. Okay, fine. Then, yeah, as I told you, procalcitonin, 0.5 to 2 nanogram per ml, it is diagnostic of SIRS. It is more than 2, it is, we can say the patient has sepsis, and more than 100, it is MODS. And what are the newer markers? Angiopoietin 1 and 2, but I told you SUPAR is the current trending one. Okay, then coming into the treatment of SIRS, remember we have to do volume resuscitation, that is the number one. Okay, and volume resuscitation is best measured by using pulmonary artery catheter. I hope you will study this in your surgery, general surgery topic. Then in case of any the etiology of the surgical urgent, we have to do operative intervention. Then nutritional support is very, very important, because we have to attain positive nitrogen balance, because there is hypercatabolism in SIR. So we have to attain a positive nitrogen balance. So we have to do what proper nutritional support in the form of calories. But remember, excessive carbohydrate is avoided. Why? Because the excess of the carbohydrates, they will do lipogenesis. Okay, they will undergo conversion to form fats, and there will be excessive carbon dioxide production. Yeah, so that is avoided. And medications, steroids are the first line, which can block the synthesis of cytokines. Then pentoxifylline is used, which is pentoxifylline you would have studied. It is used in the case of peripheral vascular disease. It is a phosphodiesterase inhibitor which interrupts the intracellular signaling and decreases polymorphonuclear activators and TNF activity. Then monoclonal anti-TNF alpha. Okay, that is monoclonal antibodies can be used, and activated protein C can be used. So coming into the complication, as I told you, there is always a balance between the pro-inflammatory and anti-inflammatory mechanisms. That suppose if the anti-inflammatory mechanism does not work, and if it is towards the pro-inflammatory mechanism, MODS set in. What is MODS? Multi-organ dysfunction syndrome. Okay, yes, and yeah, okay, and we have lots of criterias for that is multi-organ dysfunction syndrome. That is what we call as the SOFA criteria and the Cook SOFA criteria. Okay, and I hope I would study all those in surgery. So when it comes to SIRS, remember, first thing, the first key take-home message is, it is not always because of infection. It may be because of any endothelial damage. Criteria: more than 38, less than 36 temperature, more than 90 per minute tachycardia, more than 20 per minute respiratory rate, WBC more than 12,000 or less than 4,000, or more than 10% premature forms, and presence of 2 or more of above features qualifies for SIRS. There are 3 stages: stage 1, stage 2, stage 3. It is a stage 3 where cytokine storm and MODS occurs. Remember, what is the pathological hallmark? It is endothelial injury. And what is the culprit interleukins? It is interleukin 6. And remember, the other one, the triggering factor is TNF alpha and interleukin 1. And remember, biochemical or hematological analysis has to be done: ABG, CBC, blood urine, nitrogen, creatine ratio, CRP, serum albumin, calcium, magnesium, and other electrolytes. And procalcitonin is a marker. The evolving marker is the SUPAR marker. And the value of procalcitonin 0.5 to 2 is diagnostic of SIRS, and more than 100 it is diagnostic of MODS. And volume resuscitation, monitoring by pulmonary artery catheter, operative intervention, nutritional support to attain positive nitrogen balance, then steroids, anti-TNF alpha monoclonal antibodies, pentoxifylline, activated protein C has known to effective in the treatment of SIRS. And remember, complication is whenever there is an imbalance between the pro-inflammatory and anti-inflammatory state, and if it is more towards the pro-inflammatory state, MODS, etc. Thank you.